Hello all, and welcome to the Caregiver Support Series. The Caregiver Support Series is a weekly web series that is aimed at caregivers who just can't follow a schedule. A caregiver is anyone who is regularly checking in with a relative, friend, or neighbor to see how they are. They may run errands or help with housework. It can also be as complicated as providing hands-on physical care to someone who is frail or debilitated. There are over 40 million caregivers in the United States, and we are all various levels of busy. It's hard to commit to things like support groups, health fairs, or personal appointments, or in everyone's case at the moment, maybe you rarely get to leave the house. This webinar will be accessible to you every week on your timeline. And because I want to respect that time, I aim to keep these episodes to only 10 minutes. So grab a cup of your favorite hot beverage and sit back. Remember, I am always open to questions, comments, or topic suggestions. You can post below, email me, or I'm available on weekdays via telephone call by appointment. So who am I? My name is Sarah, and I am a nurse. Although the last time I gave somebody a shot, it was my diabetic cat Hank, and no, I'm not kidding. I have been with my wonderful husband Rob for 8 years, and we have one daughter, Elise, as well as Hank and a dog named Ruby. I am a certified hospice and palliative care nurse and the community educator for Hospice of Northwest Ohio. I previously worked in the ICU division at Toledo Hospital and in the Med-Surg division at the University of Washington Medical Center. I am a self-proclaimed PowerPoint nerd, and if you couldn't tell, a huge Friends fan. Since I respond well to routine, here's my agenda for each week. The first segment is called Words to Describe and focuses on the buzzwords that surround the topic of the week. In the Education Corner, I will share some information for caregivers. Today, it will be tips on how to cope with a disaster or traumatic event. Also included will be some specific nurse tips. I will list some additional resources that really anyone may find helpful. I believe in citing reliable references, and I always try to pay attention to where I get my news from. I will cite references in red. Today's topic, as you guessed it, the coronavirus. Next week, I will be talking about advanced care planning. Let's dive right in. I think the number one buzzword, or in this case, phrase, to describe the current crisis is
social distancing.
In a very close second, I would say flatten the curve, but
social distancing
definitely wins. In fact, you're probably already sick of
social distancing
by now. If I would have said
social distancing
to you last summer, I imagine your reaction would have been something like this. The source of this segment is from Dr. Joshua Gordon, the director of the National Institute for Mental Health. His article from March was about managing stress, fear, and anxiety during a crisis. I don't know about you all, but my anxiety is triggered by the information overload that is the news. Dr. Gordon goes on to talk about how trying and confusing this time is for people of all ages. One thing I definitely find confusing, how do I socially approach
social distancing?
It's such a personal and awkward issue. How do you approach someone close to you who's maybe not following or respecting the
social distancing
rule in a way that you find appropriate? No matter what, this is a disruption of daily life for absolutely everyone. The daily routines that we have come to rely on, whether we admit it or not, have grinded to a halt. The things and people that we've come to count on for comfort in difficult times have physically been taken away from us by this virus. But
social distancing
doesn't have to mean social isolation, and that is what Dr. Gordon writes about. He wants us to remember that in times like these, feeling uncertain and anxious are totally normal. He is also, of course, empathetic to those of us with mental illnesses. After all, this type of crisis can contribute to increased paranoia and worry, and the isolation can make depression symptoms worse. But just because our lives feel uncertain doesn't mean we can't find uplifting experiences and phenomenal people, the helpers, as Mr. Fred Rogers calls them. Like Dr. Gordon said,
social distancing,
does not have to mean social isolation. People are finding creative ways to reach out to loved ones, to bond as a family, to worship, and to build unity as neighborhoods. You can reach out to people with a simple telephone call or a good old-fashioned piece of snail mail. And there's more high-tech options now, like FaceTime and Skype. We've been doing those with Elise since she was 3 months old. We didn't do that right, did we? I wonder if talking to yourself counts. So let's look at our overall words to describe picture. A little bleak, right? Well, times can feel a little bleak, that's for sure. And while it's okay to acknowledge the things that aren't necessarily going right at the moment, we can't get stuck there. We have to focus on the things that are going, right. We need to count the blessings we do have. I also want to take this time to remind you to have grace with yourself. Here's my personal mantra that I repeat to myself when I'm beginning to feel overwhelmed or like I can't do anything right. Start where you are, do what you can with what you have. I'm going to give you, as a caregiver, a mantra to start with. My best is enough. I want this to be your new mantra. Chant this when you're feeling overwhelmed, sing it, yell it, whatever you have to do to understand that your best is enough. This segment is sourced by the Ohio Department of Health. These are some suggestions on how to cope during a highly stressful time. These can be used every day to help with stress as well. There are 6 different action items you need to focus on. Taking care of your body, keeping connections and or making new ones. This one is big. Making time to take breaks for yourself. Stay informed, but avoid information overload. And also, very important but underutilized by caregivers, reach out for help to whoever you feel comfortable reaching out to. The great thing about this approach is that there are so many healthy options to pick and choose from within the 6 action items that you can tailor your coping plan to work for you. For instance, taking care of your body could mean making a few healthier food choices each day, or trying some regular physical exercise. My favorite exercise is shared with none other than the legend herself, Ellen DeGeneres. Get plenty of sleep and avoid unhealthy habits like alcohol and other drugs. Keeping connections and maintaining ties like from school or church can decrease feelings of loneliness. Or try to make new ones with neighbors in creative ways. Share your feelings with someone you trust. It can be so uplifting just to talk it out. Again, very important is to make time to do something that you find comforting, that is healthy, of course. Take time for you. It's so important for your mental well-being. Unwind and make time to do things that bring you joy. Stay informed with the current happenings in the community, but make sure you're only receiving information from reliable sources. Avoid excess exposure to the news, again, information overload, but I get that that's kind of a delicate balance, especially when you're trying to stay informed. And lastly, which actually I already mentioned, but isn't it kind of funny how these things kind of tie in together and overlap? Talk to someone you trust. Ask for help. If you don't feel like you have anyone to talk to, then talk to a clergy member, a counselor, a doctor, or a professional helpline. So let's say our new mantra together again. My best is enough. Okay, nurse tips for the week. Since this is a respiratory virus, I'm going to talk about respiratory health. Your respiratory tract is anywhere that air passes during breathing. So your mouth, nose, throat, and down into the small air sacs in your lungs called alveoli. Good respiratory health starts with good oral health. Make sure you brush your teeth and take good care of your gums. Stay hydrated. Drink water throughout the day. You don't want your lips or gums to get dry where small cracks could allow the virus to enter. If you have a small enough bathroom, steam showers can be helpful. Turn the water on very hot and let it steam up the bathroom while you sit outside the shower. Allow the steam to soothe the airways and keep them moist. Be careful with this option if you have low blood pressure. Deep breathing is important too. If you've ever been in the hospital, you've seen these little contraptions called incentive spirometers. They are meant to help someone take very good inhales, deep breaths in, to prevent pneumonia in patients who are recovering from surgery. You want to take as deep of a breath as you can in and hold it for up to 5 seconds, and then exhale. Do this a few times in a row as tolerated. After your final breath hold, cough, and if you need to, clear secretions. As with anything, if you feel lightheaded or dizzy, stop. And if you've heard it once, you've heard it 1,000 times. Wash your hands and don't touch your face. If you were to start to get a dry cough and a fever, continue to do these things to the best of your ability. People who end up in the hospital with this virus are treated with a variety of medications and interventions, but mostly their need is oxygen through a tube of some sort. Here are some respiratory interventions that hospitals may use to help with low oxygen levels, starting with the least invasive and ending with the most serious. A regular nasal cannula can deliver up to 6 or 8 liters per minute of oxygen. A high-flow nasal cannula is used to deliver up to 60 liters per minute, and it can be humidified and or heated oxygen. The next step from that would be a BiPAP mask that actually forces air into the lungs and is considered non-invasive ventilation. Beyond that is the full-blown life support or the invasive ventilator. People on this machine often have to be sedated, and some have to be paralyzed in order to tolerate the tube. It's not a bad idea to think about what kind of medical care would be acceptable or unacceptable to you if you were to become ill. We will be talking more about this next week. Deborah Grassman is a mental health nurse practitioner, author, and founder of the nonprofit organization Opus Peace. She writes about lessons learned about attaining inner peace, and ironically, she has found them in people who have been trained for war, veterans. These videos you may find incredibly helpful if you are struggling with this crisis. So click below for more. Some additional resources you or someone you may know may find helpful. Thanks for watching. This has been an episode of the Caregiver Support Series brought to you by Hospice of Northwest Ohio. Next week, we will be talking about advanced care planning.